Good evening. My name is Gail, and I've had multiple sclerosis for 31 years. The year I turned 21, I was engaged to be married and was also diagnosed as most probably having early stages of MS. It started as a problem with my vision. By trade, I'm a lab and x-ray tech, and when I was looking in a microscope one day, I was unable to see around the edges of the field I was examining. I kept cleaning the microscope, thinking that was the trouble, until I asked a coworker to look. Nothing was wrong with the microscope, so it had to be me. My doctor thought I possibly had multiple sclerosis and there was no cure. After the eye episode, I experienced numb hands and feet. The symptoms would come, but always go away in a few weeks' time. I absolutely wanted to believe my doctor's diagnosis was wrong. A few years after my husband Blaine and I were married, we bought into a franchise, renting out sports equipment in Vancouver and moving there. Every morning I'd go to the store with Blaine, do some bookkeeping, and then walk 2 blocks down the street to work in a lab. One day while I was on my way to work, I was having a lot of trouble walking. I was weaving down the sidewalk like a drunk. I couldn't pick up my left foot, causing me to limp very noticeably. By the time I got to the elevator, I was struggling to keep my balance and not fall over and pick up my foot. A lady I knew quite well got in the elevator with me and asked why I was walking so funny. At that point, I was so upset, I just needed to tell someone about my possible MS. She stood and listened to my story and we cried all the way up to the 5th floor. I then realized the denial was over. I tried many different remedies to keep my MS from advancing. I tried various gluten-free diets, no sugar, no flour, no dairy diets. The change in food made me lose so much weight that when I was down to 88 pounds, I decided I couldn't continue the diet anymore. I tried acupuncture treatments, myofascial massage, chiropractor, all the MS medications and steroids prescribed by the doctor in order to keep me working. But my fatigue, which leads to total exhaustion, became so severe I could no longer work an 8-hour day. Fatigue is a misunderstood condition. Imagine the feeling you get when you exercise to the point of complete exhaustion. Well, times that feeling by 10. Severe fatigue with MS makes simple tasks like dressing or brushing your teeth extremely exhausting and difficult. When a new MS medication hit the news, my neurologist recommended I start taking it. It was an interferon injection, cost $1,800 a month, and there was no coverage. In order to afford the drug, we put buying a condo on hold and put every extra cent into purchasing the medication. I was one of the first MS patients in Canada to start and pay for the interferon. Taking the medication seemed to prevent my condition from getting worse, but Blaine and I decided to move back to Saskatchewan, where we grew up and where family lived, just in case I needed help. I walked with a cane and tried to manage fatigue for 10 years while injecting beta-serin every second day until year 11. Year 11, I began having problems. My injection sites would not heal, leaving me with golf ball-sized lumps. My left leg became very spastic, knee bent at a 45-degree angle, and my entire leg was pulled up. I hopped with my good leg for a few months until my right leg became spastic also, and then I was forced into a wheelchair. Sitting in a chair full-time with my legs tucked, so tight around my chair seat that my heels were touching my butt, was how I spent my days. I tried every muscle relaxant on the market. The Botox injections made me very weak and only slightly looser. My body was in spasm night and day, preventing me from any rest and in constant pain. We had to cut the legs off the bed so I could roll from my chair into bed, only able to lay in a fetal position. I fell between the bed and the chair many times trying to get up, and I had to call my mom for help. My family and Blaine took turns calling me throughout the day to make sure I was okay. I was never okay, but as long as I hadn't fallen and I answered the phone, I was okay. There was not much more that we could do. It was absolutely horrible watching my own body fall apart. Another reason we moved back to Saskatchewan was to raise elk. Blaine had a trade show in the US promoting elk antler capsules for arthritic pets. His table was close to a lady selling peptide. Her peptide was for arthritic pets also. When Blaine talked with a peptide seller, she commented that her peptide helped pets, but also helped people who had multiple sclerosis. It was not a cure, but it helped. Out of desperation, we jumped at the slight chance the peptide may help me. We wired $10,000 to the doctor who developed the peptide in the Bahamas, and then we flew to Freeport to try the peptide for a week. When we got to our hotel room in Freeport, all I had was a cell phone number to contact the doctor. Blaine called him many times the first night we were there, and we got no answer. There we were. Our money was gone. I was still in spasm and pain, and we couldn't contact the doctor, who we never met, and who we had wired our money to. That night was sleepless for both Blaine and I, and as we tried to plan what we should do next, the phone rang. David, the doctor, was on his way to our room with the peptide. I spent a week of taking peptide every day with water therapy and massage. On our last day in the Bahamas, David called to see how I was doing. Blaine and I had just discussed how we were disappointed my condition had not changed all week. As Blaine sat talking about me on the phone to David, he turned to look where I sat. Something has changed. You won't believe this, David, but Gail's feet are flat on the floor and they are pink, not purple. Once we were home, I continued taking the peptide daily. Small changes happened. My spasms weakened and I felt like I had a little more energy. Most of you may have heard of the liberation treatment for MS. It was very controversial and not recommended by any doctor because they didn't know enough about it. Again, it was not a cure, but I, like many MS sufferers, decided to have it done anyway. Lanigan, the small community where we live, sponsored a fundraiser. With the financial help from the benefit and generous donation from family and friends, I was able to afford surgery in California. The vein specialist found my jugular veins were both 90% blocked. When we left the clinic in California after surgery, the doctor advised me to get moving. Now that nothing was blocked and my circulation had returned, it was time to exercise my skinny, atrophied muscles. I found the professional and knowledgeable staff at First Steps Wellness Center who had a completely different, more aggressive program for disabled people. First Steps' goal was to help spinal cord injuries, but saw the need to help other conditions, and so I was their first MS client. Twice a week for the first 2.5 years, I went from Lanigan, a 2-hour drive, to Regina to work out with a therapist for nearly 3 hours per session. Many sessions at First Steps were very difficult at first because I started going there when I was unable to do little on my own. I couldn't even get out of my chair without any help. A therapist had to pick me up, help me lay on the table, and use a lot of his strength to try and get my legs straight. With the very reasonable cost of therapy and travel, it was still $1,000 a month expense. We were able to receive help with travel costs from Telemiracle, a unique and wonderful organization. Most of the time, my mom drove me to Regina, and many times I called to tell her I was going to cancel my therapy because I was tired and it was too hard. 10 minutes after I talked to Mom, she'd be at my house, insisting we go to Regina as planned. But now I've been going to First Steps for 3.5 years, and over that time, many things have changed. I have less spasms, more energy, strength, no atrophied legs. I've had to buy bigger pants because my legs got muscular, and a better state of mind. Thank you to First Steps for seeing my potential. Thank you for your positive attitude and encouragement. While you train with me, all the exercise, stretching, and muscle building can get tedious, but your coaching along the way gets it done, and gets it done right. Thank you, First Steps, who are dedicated to help improve all your clients' quality of life. With everything I have learned and all the positive changes I have experienced, you are nothing short of amazing. Thank you.